Hello, everybody. Welcome to the Ghanaian Doctor, and today I'm going to discuss diabetes. What is diabetes? Diabetes is when the glucose, when checked, is seen to be 7.0 when you have not eaten, or if you've eaten, seen to be 11.1 2 hours after eating. Now, usually this is in addition to having certain symptoms like urinating more frequently than usual, eating more frequently than usual, and also drinking more water more frequently than usual. Today, I'm going to delve into the details of diabetes, how it comes about, some of the common causes, and how to, manage it at home by yourself before involving the doctor. First of all, diabetes happens when insulin, a hormone which is very important in regulating glucose, goes down, or the cells where the insulins work are not able to use the insulin. So doctors will say that there's either a reduction in insulin level or a resistance to insulin. Today we talk about type 2 diabetes, which is more common in our environment, especially in Ghana. And usually that comes with insulin resistance, where the individual has insulin or even high levels of insulin. However, the insulin is not able to work. It will interest you to know that currently diabetes is even diagnosed in children as young as 2 years. I know that's very young, but that should give you an idea how broad the disease is now compared to how we knew it before. So, what are some of the complications that can happen from poorly controlled diabetes, or that can happen when the blood sugar is consistently high? Number one, it can affect the small vessels in the body. These are vessels that supply places like the eyes, places like the kidneys, and then the nerves. Now, when these vessels are damaged, usually it causes irreversible damage. So it's something we should pay attention to. The second thing, it can affect the big vessels in the body. These are vessels that supply the brain. When it's affected, it can cause a stroke. These are vessels that affect or that supply the heart. When they're affected, it can cause a heart attack. And these are vessels that supply other large organs in the body. So, what are some of the things that lead to an increased risk of diabetes? Number one, obesity. Obesity is having a very high body weight compared to your height. Sometimes we use the waist circumference to calculate and define obesity. But anyone whose BMI is 30 or higher is said to be obese, and this poses a risk factor for diabetes. Being overweight or having a BMI from 25 also puts you at risk of having diabetes. Now, having a family history, your parents, mom or dad, or sibling being diabetic puts you at risk of diabetes. Actually, there's been a genetic component that has been identified as part of diabetes. So if you have a close relative having diabetes, you should be checking your sugar regularly just to make sure that you don't get it. Hypertension is another risk factor. High levels of cholesterol, depression, polycystic ovarian syndrome. This is a disease where there are fluid-filled cysts or collections in the ovaries of women. And then physical inactivity, a sedentary lifestyle, staying at home, not moving around, not going around, can lead you at risk of diabetes. Usually, some of the things you can see when diabetes is starting is what I described before: urinating more frequently than usual, drinking more water than usual, eating a lot compared to before, and finally, losing weight. Now, the reason why weight is usually lost in diabetes is because the insulin needed by the body cells is used to use the glucose. So if the body is unable to use this insulin, that means it's not able to absorb the glucose and use the glucose by the cells. Because of this, you may have a lot of glucose in your blood, but your cells may be starving. So the insulin acts like little soldiers or little, let me say, keys. And when they open the padlock to the cell, the glucose can enter the cell and be used by the cell. So if these soldiers or these keys are not able to open these padlocks to the cells, you could have a lot of glucose in your blood. However, your cells will not be able to use this glucose. And this can sometimes cause weight loss in individuals who have diabetes. The most important thing I would want you to take from this particular part of the discussion is that in most people, diabetes doesn't come with any symptoms. We don't see anything showing that they have diabetes. Nothing. Zero. They are fine, just like me and you, walking about, living their own life, but then diabetes has started. Because of this, it is recommended, the American Heart Association actually recommends that at least from 35 years upward, we check our blood sugar every year so that we catch diabetes before it comes. This is because on the average, people only identify they have diabetes after they've had it for at least 4 years. And by that time, a lot of complications may have happened. Checking your blood sugar regularly from at least 35 years upwards gives you an opportunity to catch this disease before it becomes a problem. So let's assume we know someone who has diabetes, or our doctor has told us we have diabetes or even prediabetes. Prediabetes is when the blood sugar is below the range for diabetes. So even though diabetes blood sugar is from 7 upward, prediabetes blood sugar is from 6.1 to 6.9. So it's called prediabetes. So some of the things we can do to control diabetes or prediabetes: number one, our diet. Eating a high fiber diet with minimal processing is ideal for controlling our calorie intake, which will reflect well on risk of diabetes. Some foods with high fiber and minimal processing include brown rice, wheat bread, pear, beans, legumes in general. Number two, stop drinking sweet drinks. These drinks overwhelm the body with a lot of simple sugars, which predispose to diabetes. The third one, foods with added sugar. Cut down on adding sugar on your foods. You are eating some porridge, you can add a little sugar, no problem. But don't keep on adding so much sugar to the gari, so much sugar to the Tom Brown, so much sugar to the breakfast foods especially. Cut down on adding sugar to your foods. Number four, choose fish over meat. Fish has been seen to have certain factors that are healthier compared to meat, especially for individuals who are at risk for diabetes. And then the fifth one, exercise. This advice goes for a lot of medical conditions. Exercising at least 3 times a week, 30 minutes a day, is way more than enough to help you keep your body active. You can do some brisk walking, 15 minutes to a hill, 15 minutes backward. You don't have to start from there. Start slowly and build up to a point that your body can handle. Now, diabetes comes with a lot of complications which are very, very, very disturbing. One of them is diabetic foot disease. This advice goes to individuals who have been diagnosed with diabetes. Please make sure that your feet are always well soled, your shoes are always well worn before you move out. Make sure your shoes are fitting well before you move out. And make sure that you check your feet for any injuries before and after you wear your shoes. Thank you. This is the Ghanaian Doctor, and see you next time.